Okay. Thank you, Claudio, Mañas, Faisal, Robert, for inviting this presentation here. Good morning, good afternoon, good evening to all the people that is joining this presentation in this meeting. The Global Brain Consortium is a robust and dynamic network of about 250 neuroscientists from more than 30 countries with the purpose of bridging the brain health disparities worldwide, primarily focused on EEG research. It was created in 2019 at the Montreal Neurological Institute with the presence of around 60 members, many of them from Canada. And the main purpose of the Global Brain Consortium is advancing neuroscience for global health with a focus on low and middle income countries. The second meeting of the GBC was in Varadero, Cuba in 2020. It was a hybrid meeting due to the COVID. At that time, more than 100 people participated, most of them online, more than 60 people online. And from 21 to 23, all the meetings were online, and in 24, the meeting was hybrid. It was a huge meeting in Chengdu, together with the Belt and Road meeting. And in that meeting, there was a celebration of the 100 year of the EEG and a memorial symposium to honor the memory of Dr. Royon, who was one of the initiators of the neurometric in the 1977. The GBC is born as a response of the Geneva headquarters meeting in 2016, organized by WHO and OHBN, in which around 2 million people were signaled that to be affected by neurological disorders in low and middle income countries. But however, less than 10% of the neurological research addressed their needs. So the focus of the meeting was to bridge the health gap between low and middle income countries and rich countries. And that was the participation of Alan Evans, Pedro Valdez, Catherine Amos, and Maria Luisa Bringas. The EEG was selected as the most accessible neuroimaging tool globally, not only because of the low cost and portability, but because this is directly applicable to primary health care, and it can be incorporated in any healthcare facility all around the world. So the EEG was the basis of the GBC work. The GBC is chaired by Pedro Valdez and Alan Evans, and there is a steering committee: Faisal Mushtaq, Catherine Amos, Maria Marton, James Roskamp, Paolo Rossini, Jorge Bosch, Paul Thompson, Deshon Yao, and Mike Milham. Up to the present, the Global Brain Consortium has incorporated many new researchers from many different countries, and especially from low and middle income countries. There are Cuba, Malaysia, Colombia, Ghana, Rwanda, Ethiopia, Uganda, Honduras, Barbados, Jamaica, Peru, Chile, Argentina, Brazil, India, Pakistan, Mexico, with Canada, USA, Cuba, and China with the top contributors of the project. Besides the structural organization, the GBC is organized in work groups: the global EEG norms, the COVID-induced brain dysfunctions, neuroscience of early adversity, disease progression modeling, global longitudinal adolescent development, the Bacomics group, with key partners as WHO, OHBN, IFCN, INCF, and institutions like Brain Canada, Luckmer Center, Compe from Canada, University of West in China, Cuban Cuban Neuroscience Center in Cuba, the MNI at McGill, the Leeds University in UK. Some of the most active projects are the global EEG norms, who has produced large multimodal databases with data curation procedures, standardization of preprocessing and analysis pipeline, And one of the most important results is the harmonized multinational QEEG that offers a normative database of resistant EEG of 9 countries, 14 laboratories, with a procedure for harmonization among different hardware from different producers. And for the first time, it incorporates norms from the full cross-spectral matrices that has shown to be very much useful than just the log spectra that we normally use. The COVID-induced brain dysfunction is based on in a longitudinal study in Cuba that so incorporates not only a cohort of COVID patients, but also a cohort of people that were at risk of COVID, and they were isolated together with the COVID people, and they were discharged after they tested negative. But these people also suffer all the burden, all the isolation, and all the stress that the COVID people. So it is good for us knowing which are the brain damage due to COVID and all the burden that suffer these people, and there are already we have found different.
2 minutes left.
Okay, so we have the early neuroscience of early adversity. We have the Bacomic group is in China. This is brain apparatus, data-driven electrophysiological approaches. Paolo Rossini and Giasseri Turria. We have biomarkers of Alzheimer's disease, biomarkers of Parkinson's disease, global longitudinal brain development that bring together many different projects. Neurohabilitation by Talia Harmony in Mexico, the Boring Bradford in UK by Faisal, longitudinal studies and education in Cuba, the Infantix project also in Cuba. The Infantix project is a populational brain screening program that started in Cuba in the 90s. It tests all children, newborn, to detect possible hearing loss and implant them with devices, cochlear devices, to avoid the neurodevelopmental delays. The GBC offers also an open science M&I ecosystem based on the Montreal Neurological Institute that uses LORIS and C-Brain. And these are the LORIS is the storage, C-Brain is a repository of pipelines, and there is a full integration between these two systems that puts offer to scientists all around the world all the not only data tools but also high performance computing, and they offer different centralized data, different models, distributed analysis, federated data, federated analysis. There is a strong integration between EEGNet, EEG Lab, EEG many labs ecosystem. They share a lot of data and platform together. At the GBC webpage, they can find a lot of information around this. Tutorial courses in the YouTube channel. There are Vera Gross memorial lectures by outstanding scientists, Janina Galler, Mike Milham, Mike Brisper. Also, there are dozens of presentation, video, keynote lectures at different international conferences. And finally, I just want to, I just made a table about the possible opportunities between the GBC and the EEG101. I put here as possible domain normative data, methodology, data platform, low and middle income countries access, tools in C-brain, EEG annotation. I put here the contribution already made by the two groups and the joint opportunities to expand global normative data, to expand the scope to low and middle income countries, cross-validation methods for benchmarking across cohorts, federated data using the EEG101 standard for low and middle income countries, a container of base tool deployable with zero installation, and joint replication and annotation.